is done overnight. And so we want to make sure that we recognize that cessation refers to the discontinuing use of tobacco. And tobacco is a very addictive substance. It's an addiction. And so when we talk about addiction, obviously there's also a withdrawal component, and is really, quite frankly, a process. So when we talk about cessation today, we'll be saying cessation and treatment because we believe it goes hand in hand. And we want to make sure that it's clear from the very beginning. So we'll be utilizing the term cessation and treatment in combination throughout today's webinar. So today, this morning, we're going to briefly reintroduce the Latino Coordinating Center for Tobacco-Free California, as well as the services that we provide. We'll also provide an overview of the challenges implementing cessation and treatment services for the Latino community. We'll identify specific recommendations that are aimed towards promoting and increasing cessation and treatment services for the Latino community. And then we'll discuss what are some cultural considerations to keep in mind when we work with the Latino community, so that we will work with them in a way that's culturally appropriate for the values that the Latino community holds. So all in all, we hope that at the end of this webinar, we have a better understanding of the existing gaps, the existing challenges, and we also have an idea of some potential steps or strategies that we can consider as we move forward with cessation services and treatment. So if this is the first time you are hearing about the Latino Coordinating Center, or if this is the first time you're joining one of our webinars, we welcome you. We're glad to have you here. If you are a returning customer, we're glad to have you back. We are a program of the California Health Collaborative in partnership with USC, and we are one of the 6 priority populations that are funded to serve the priority populations in California. And our overall mission is to improve Latino health through the implementation of tobacco control policies that are really aimed towards reducing the disparities. We also aim to have more statewide collaboration and empower the community so they're able to mobilize individually and really advance the change that we see at the local level to reduce the disparities that impact the Latino community. We also want to briefly highlight the 8 regional projects funded in California to serve the Latino community. Quite frankly, we work with any organization that is aiming towards working with the Latino community, whether it be the 8 regional projects you see here on your screen, competitive grantees, local aid agencies, statewide, we work with everybody. So if you want to work more closely with the Latino community, or if you have any questions, please feel free to reach out to anyone of the team, and we'll be glad to provide you with additional services. So as I mentioned at the very beginning, we have a policy platform in which we identified 4 policy priorities. The first is to prevent youth initiation of tobacco use. The second is to prevent exposure to secondhand smoke and aerosols. The third, which is what we're talking about this morning, is to promote tobacco cessation and treatment among the Latino community. And the fourth is to build community capacity and leadership. I want to let everybody know that the first 2 policy priorities, we've had 2 webinars discussing those priorities. Both of those recordings can be found on our YouTube page, which we'll put the link momentarily in the chat box. You're welcome to go to our page and view those recordings. And then we'll also have a 4th webinar talking more about building community capacity and leadership also in the near future. So stay posted to partners, stay posted to our emails and our newsletters for more information regarding that. But today we want to talk about cessation and treatment. Now, I'm going to post a quick poll. And the question that we want to ask before we continue is, are you currently working on cessation efforts with the Latino community? So their options are yes, no, yes, but not specific with Latino community. So we want to get a feel for who is here with us this morning. So we'll give a minute or so, and then we'll go ahead and continue on. Well, 75 people participated thus far. A couple more seconds. Okay, I'm gonna go ahead and end the poll. Let me show the results. So based on the feedback provided, based on the responses, so we have about 31% of you are working on cessation services, specifically with Latino community, 28 are not, And the majority of you, 41%, are doing some type of cessation efforts, but not necessarily with the Latino community. And again, we really appreciate everybody's responses. We asked this because we want to really emphasize, especially for those that aren't necessarily working in cessation, our goal in California, as you all are aware, is to reach the end game of ending all commercial tobacco by the year 2035. And we understand in doing so, as we implement policies such as tobacco retail licenses, smoke-free multi-housing, smoke-free workplaces, etc., there's should be an emphasis and also have a cessation component, have a treatment component, because there are going to be several individuals who are going to be affected by those policies that want to quit smoking. So how do we also accompany these policies with some additional strategies to help those that want to quit? And that's really what we want to emphasize, that cessation and treatment are going to be very vital to reaching the end game. More specifically, in the Latino community, we know that Latinos are the largest ethnic group in the state of California, with about 40% of the state's total population identifying as Latino, and that's only projected to increase by the year 2030. When we look at tobacco use among the Latino folks, we see that about 701,000 Latino adults use tobacco or smoke. This makes Latinos the second largest group of adult smokers in the state of California. Now, we'll point out that this number, the total number of Latino adults smoking, has decreased within the past years, which is, I think, really a result of the work that we're doing both at the local and state level. But there's still a lot of work to do. We're still the second largest group of adult smokers in California. Now, we don't know exactly how many or what percentage of these 700,000 folks are either trying to quit smoking or have tried, but we do know when we look at KICA California's data is that from January 2022 through June 2022, 23% of all individuals who contacted KICA California identified as Latino. Now, we'll provide more information in a few minutes about KICA California, but they are a free resource, formerly known as the Smokers Helpline, that provides cessation services for folks who want to quit smoking. So what this really shows us is that there is an interest from the Latino community to quit smoking. And there's several cultural considerations that we're going to discuss as well that might be reasons as to why they're trying to quit. The problem, though, or the struggle that we're facing, this is why we're having this webinar this morning, is that there are not as much resources that are either available for the Latino community or that are culturally and linguistically appropriate. And those are some of the different challenges and strategies that we're going to discuss as well momentarily. I will also point out that Latinos were the second largest ethnic group to reach out to KICA California within this time frame, only following non-Hispanic white adults. So we recommend that tobacco users be encouraged to quit early and often, and they be provided with evidence-based and culturally appropriate cessation services. Now, this is particularly important for the Latino community, considering the large population that we have here in California, but also considering the fact that Latinos also experience significant disparities. We see more targeting of tobacco marketing to the Latino communities. We know that certain Latino neighborhoods also are more populated by tobacco retailers, and therefore more likely to experience or use tobacco at an earlier age. And it also creates the norm of tobacco being a normal thing and is constantly present in our communities. So it is very important for us to really target Latino community for cessation and treatment services. We recognize and understand that there's a lot of different forms of treatment. There are several medications, there is nicotine replacement therapy, there's also behavioral interventions, both individual, group, and telephone counseling like KICA California. And there are research to show that all of these treatments here listed are effective, are evidence-based, and we advocate and we promote all of the services, all of these different treatment options here listed on your screen. The trouble that we experience, or the challenge that we face, is that Latinos have difficulties and challenges accessing healthcare and behavioral health services, making them less likely to use these treatments. If in order to obtain these medications you see listed on your screen, they have to obtain a prescription from a doctor, and they're not necessarily going to their doctor, or they don't have health insurance, and so therefore discouraged to see their doctor to pay out of pocket, then is the likelihood of them receiving these medications is very minimal. We also, when you think about some of these behavioral interventions, if they are not told or informed about these services, then it's going to be, again, the likelihood of them obtaining the services is very unlikely. So how do we bridge that gap? How do we build a bridge to connect with Latino communities and not necessarily expect them to come to us or to come to these health services, but how do we make it more accessible and how do we take it to them? And that's one of the different recommendations that we're going to be providing in much more detail momentarily. So with that being said, I'm going to pass it on to Kimberly, who will share more about our first strategy, which is to increase referrals to KK California.
Good morning, everyone. Thank you so much, Rosenda, for introducing us. I'm Kimberly Sanchez, and I'm a regional coordinator here at the Latino Coordinating Center. And so today I'll talk to you all about increasing referrals to KK California. So one of the goals here at the Latino Coordinating Center is to promote tobacco cessation and treatment by increasing referrals to KK California. This is a really great program for everyone to use because it provides individualized coaching, which has been proven to double long-term quit rates. And they also work really hard towards diversity and inclusivity, which is shown in their coaches who provide help in English, Spanish, and other languages through text, chat, or phone call. During this conversation, a person can specify what kind of support they need, and they'll get together with the coach to develop a quit plan. And they'll develop this based on their goals, history, and situation. So an important factor that we really want to highlight is that KK California is a program that does not ask for Social Security number or any other questions that may cause concern among our undocumented communities. This resource is a really safe place for the Latino community to receive help without having their documentation status be a determining factor. So we recommend that tobacco control programs, such as all of you, work with care systems to adopt a systemic approach to refer tobacco users to KK California. One of the ways to adopt this approach is by using the Ask, Advise, Refer protocol that you see on the screen here. However, refer is sometimes rendered as assist because it usually involves a conversation between the provider and the patient on what treatment options work best for them. This protocol requires providers to ask every person if they use tobacco, and if they do, to then advise them to quit, and then refer or assist them to treatment options such as KK California. During this conversation, the providers usually will also have a discussion whether the patient feels comfortable or if it's beneficial for the patient to be prescribed nicotine patches or other types of medication to help them quit. And for those who are interested, you can call the KK California number that's on the screen, or for more information, you can visit kickitca.org. And here we created a QR code for all of you to scan. We can also provide a link in the chat box, but it's a guidebook for the Ask, Advise, Refer guidebook that we created for the Latino community. And it was created by us in partnership with BASTA. It was designed to guide community health clinics, health centers, and organizations that serve Latino communities to show how to refer Latinos to KK California. This can be thought more of a screening tool with specific cultural considerations that should be utilized to tailor a program's approach when working with the Latino community. These cultural considerations will be shared a little bit further on in our presentation by my colleague Luz. But until then, I would like to invite Dr. Cindy Valencia to speak with you all a little bit more. Thank you.
Good morning, everyone, and thank you, Kimberly, for a wonderful overview of KK California services. As Kimberly mentioned, my name is Cindy Valencia, and I am very humbled by the opportunity to serve as an advisory board member for the LCC. I am also the operations director for California Quits and an early scientist. During my section, I'll briefly go over tobacco treatment disparities among Latinos with Medi-Cal. My research has focused on Latinos with Medi-Cal, and I'll cover a couple of studies at the end. I won't go into too much detail, but we'll put some links in the chat box if you're interested in the details. I'll provide an overview of California quits, and I'll share some strategies to consider for engaging Latinos, along with some resources for you. Before I begin, a little bit of background. In California, 42% of adults who smoke are covered by Medi-Cal, and over half of adults insured by Medi-Cal are Latinos. I just want to emphasize how important it is to engage Medi-Cal managed care plans in this effort, as many Latinos are covered by Medi-Cal. In our study and national studies, we know that Latinos report less provider advice and assistance to quit than non-Latino white counterparts. And as Rosendo mentioned earlier, even state reports, Medi-Cal reports show that less tobacco cessation medication use is happening among Latinos compared to all other ethnic groups. I did want to show this slide. I know it's super busy, but I do want to emphasize that California Quits, a project under the leadership of Dr. Eliza Tong, has been engaged in this space for many years. And so we work with safety net clinic systems. This includes community clinics and public hospital clinics. We work with Medi-Cal managed care plans and health departments. This work started in 2018, and I do want to make a shout out to two of our team members who are here, Shannon Haggett and Maureen Sharma. You may have worked with them in the past, and you may have even engaged with us through our learning collaboratives. The learning collaboratives are really the intensive training and technical assistance that we provide on an annual basis. To date, we've had 47 partners engage. If you're interested in learning more about who's engaged, please visit our website for a full list. I think it's important to know who we've already worked with and where they are. We provide training and technical assistance and a lot of resources around, the nuts and bolts of the clinic workflow, quality metrics, and we also host 2 work groups. One is for Medi-Cal managed care plans and one for health departments, with this idea that, California Quits, as a multi-year funded project by the California Tobacco Control Program, can advance the integration of tobacco treatment through a multi-sector approach. So how to engage with health systems. It's super important to leverage existing relationships that you may have. These may have nothing to do with tobacco. It may be a relationship that you have, but leverage that relationship to get in the door. It's super important to identify shared goals and drivers for change, understand why the health system would want to engage in this effort of integrating tobacco treatment today. Why would it be a priority today? And how do we identify win-win solutions? And it's super important to convene with appropriate stakeholders, such as leadership, clinic managers, quality improvement providers, and staff. It's also important to understand tobacco quality measures. Community clinics and public hospital clinics, they report on these measures. So they're tracking rates of screening and potentially counseling. So understand what these are and understand what the drivers to report on these may be. Seek opportunities for natural alignment, understand what local lead agencies may be doing around Ask, Advise, Refer, and connecting to KICKIT. Identify whether tobacco measures is a priority or not. If it is, amazing. If it's not, how do we prioritize tobacco in this effort? And then I mentioned that some of these clinics have requirements, right? So are they receiving payment for these requirements? Are they receiving payments for improving these measures? Or maybe they're receiving grant funding to work on this specific tobacco treatment integration effort. So here I've shared some lessons learned. Some facilitators that we found are helpful over the past couple of years are funding that it's a priority, that there's leadership buy-in, identifying a champion, that there's staff capacity, a super simple workflow, and that training is provided. And how do we address some of these barriers? So incentives, rewards, and recognition programs can be helpful. Aligning goals with existing ones, reviewing and addressing workflow gaps, and engaging staff impacted by the change or the implementation. And so I mentioned that we recently published 2 studies related to Latinos on Medi-Cal and this disparity. In our study, unfortunately, we found that Latinos continue to report less provider advice and assistance. We had hoped that with the Affordable Care Act's expanded access to Medi-Cal health insurance, that this would help. However, that was not the case. And one of the factors associated with this difference was that Latinos didn't visit the doctor as much. So, and they're also less likely to be daily smokers. Latinos tend to engage in light, occasional social smokers. Thank you, Maureen. She's just put a link to the article if you're interested in the details, but kind of keep that in mind, right? Latinos are visiting the doctor less, and Latinos are maybe engaging in non-daily smoking. So what are the implications of that? And I really want to drive this message home. It's really important to take a proactive outreach approach to not only work within clinic systems, but leverage that encounter and think about ways to engage with Latinos outside of the clinic. There are a couple of studies here that have shown that Spanish-speaking Latino callers, like for example, were more likely to respond to a mailing that they received at home that was paired with the free nicotine patch offer. And in partnership with the Los Angeles Department of Health Services, we conducted an outreach study pilot that I'll go over in a minute. And here we did a proactive outreach strategy using a local area code to refer unassisted smokers to the quit line. So we randomized some patients, and either they received a call from a 888 area code or a local 213 area code. And we simply asked them a question if they were interested in getting a referral to Kick It California. So we didn't wait for them to come back in. We knew they were tobacco users. We knew they hadn't received help, and we gave them a call. And guess what? There was greater response from the Spanish-speaking smokers compared to English-speaking smokers. So what does proactive outreach look like? In this slide, I want to highlight some of the work that we're doing with the Medi-Cal managed care plans to do just that. We're working with HealthNet, LA Care, Kern Health, and Molina. And they're doing just that. They're going to take a list of Medi-Cal members that are identified as tobacco users. They're going to set up agreements with Kick It California, share that data. Kick It's going to call their members and offer services. Are you interested in Kick It California services? And then they'll provide a feedback report back to these plans to let them know what percentage they were able to, offer services to. So in closing, I think, excuse me, partnerships are super important to accelerate this work. If we want to achieve health equity, we really have to think about a multi-sector approach and considering population health, proactive outreach, novel strategies that are tailored. For example, strategies that are tailored that may resonate well with Latino smokers, Latino tobacco users, and community-based partnerships can really help improve local health equity. Here is a slide with information about our website. We do have a toolkit, videos, resources for providers, and please feel free to join our newsletter for the latest updates. In addition, for anyone working with behavioral health agencies, UCSF Smoking Cessation Leadership has a toolkit that you might find helpful. And excuse me, the Healthy Living Clinic Initiative also has additional resources here as well. And now I'm going to pass it on to Luz for cultural considerations.
Thank you, Cindy. And as Cindy mentioned, I will be discussing a couple of cultural considerations to have, or also a culturally appropriate approach to helping Latinos quit tobacco. So beginning with, and 1 second. There we go. So important to know, and I'm not sure if you can all see, I think, there we go. Sorry, technical difficulties there. So just want to highlight, I think, again, we're being that many of us are already working in tobacco control or are familiar with the field, at least. I think sort of preaching to the choir when I'm saying culture matters, but do want to re-emphasize this, that culture does matter. And especially when we're thinking about the health settings, behavioral health settings where individuals are seeking either treatment or asking about treatment or getting advice or being referred to actual cessation treatment or actually doing a quit attempt. Again, important to take culture into consideration in terms of how you interact with the patient or client. So as we have mentioned in previous webinars, for Latinos, family is of particular importance, so especially children. So sometimes children are often the reason why tobacco users want to quit. So sometimes talking about how their children's health and well-being will be enhanced when they quit may actually help and strengthen the motivation to actually move forward with a quit attempt. And we also know that behaviors and decisions of individuals are often geared towards pleasing the family. So again, really highlighting that a lot of times or oftentimes within Latino culture, family is at its core, at the center. So knowing that important decisions are generally not made without consulting others in the family. So it may be helpful to engage the family as well to sort of enable quit attempts. And in the like manner, oftentimes in Latino households, there's a female head of the family. So this female head of the family commonly makes the health decisions for others. So it may be also especially helpful to engage her in supporting family members who are quitting. And this could be through various ways, whether it's actually engaging the person if they are there with the patient, or sending out education materials, maybe where more often than not, there might be a female head, for example, sending it directly to the home, or sending it through with children through school flyers and whatnot. And unfortunately, many Latinos believe that uncertainty is inherent in life. This is known as fatalismo, and therefore do take each day as it comes. And again, I say unfortunately, but I also see this as a really positive attribute. So sort of like not worrying about the future, more living in the present and whatnot. So some of the sayings that you might hear with this, it's a saying that says, lo que Dios quiera, or as God wishes. So really working with patients and reminding them that they also do have agency over their health and their health decisions, and therefore can affect their health outcomes by, for example, doing a quit attempt. And we know that Latinos as a group, and especially Latino immigrants, are more religiously observant than the general public. So it may be helpful to encourage them to turn to their faith tradition for strength as they try to quit. And really this, the way I see it is just looking at healthcare in a more inclusive way. So really trying to pull from different support systems that are not just healthcare or clinicians, but we're looking at the family, we're looking at religion, we're looking at community in order to support individuals who are trying to quit. Healthcare providers, in particular doctors, are viewed as authority figures. So Latino patients may be hesitant to ask questions or raise concerns about a doctor's recommendation, fearing that doing so would be perceived as disrespectful. So a couple things to note here is that when a patient, especially one that's Latino, is, for example, nodding their head as they're speaking to their provider, it really might just be a cue that shows that they are listening versus that they agree or understand. So as a clinician, as a provider in the healthcare setting, really trying to make space for the patient to ask questions, share concerns, and also trying to bridge that gap of perceived power differentials between the patient and provider so that they can be more comfortable sharing their questions and concerns, and really, again, likely lead to a more successful quit attempt. And as we're familiar with the Western medical model that focuses on data gathering and tracking, there's also an insistence of adhering to specific appointment procedures. This will not always resonate with the Latino culture. So important to take the time to explain, for example, why certain data is being gathered, what is going to be done with that data, or why a specific procedures need to be followed in order for a patient to receive care. These things are just important for the patient to know, and therefore it could just sort of streamline the process of actually receiving care and allowing Latinos or just any individual seeking care to feel more comfortable with the care that is being provided. And finally, Latinos expect healthcare providers to demonstrate personalismo or formal friendliness. So when a provider, if a provider comes in maybe a little bit hurried, they're aloof, they're sort of distant with the patient, this really can affect the relationship between the patient and provider. This can form resentment on part of the patient and therefore decrease the likelihood that they will actually follow any treatment plan or accept any advice coming from the provider. So again, taking into considerations really the culture and also the patient's needs it's very important in order to improve treatment and care and also the success rate of any quit attempts. So now that I have mentioned those cultural considerations, I do want to pass it on to Janet, who will be expanding on local access to support cessation support.
Thank you so much, Luz. My name is Janet Rodriguez, and I am part of the USC team of the LCC team and serve as the regional coordinator for the Los Angeles, Tri-County, as well as the South Coast region. And I've been in tobacco control for many years, and I'm really excited that it seems as though we're now talking more about cessation, which is super important if we want to reach the end game. So I will be talking about expanding local access to cessation support. And a lot of information has been shared by my colleagues already to the importance of cessation for Latinos and shared some of the resources available. But we also wanted to emphasize the importance of local programs and support for cessation services. And before I get started, I wanted to share that I participated in the tobacco-free call yesterday, or the undue tobacco call, as it's now called. And I learned that local lead agencies will be sharing publicly what are the cessation services available in their community. And I think this is really great to hear that this is going to be available via all of the local lead agencies. But I was also surprised to see that there were certain local lead agencies that mentioned in the chat that they couldn't find any local cessation services. So this is why this section is super important to me. I hope some of the things that we talk about here can provide you with some insights and ideas if your local area doesn't have any local cessation services, and what you can do to change that, right? Because we need to be able to provide cessation services if we want to reach the end game. So as we have mentioned before, Latinos are not a monolith. We're a very diverse group, so there's no one size fits all. The Latino community is a very diverse group. So therefore, we need to have different ways of reaching Latinos. So in particular, in the local community, we actually have an opportunity to learn about our local community. So get to know your community in a way that will allow you to provide the services that are geared for your area. So we wanted to provide some recommendations to ensure that services are culturally appropriate for Latinos. And the first idea that we would like to share is to train promotoras de salud to become tobacco treatment specialists. Promotoras de salud, or promotores, if they are male, if they identify as male, are, or in English, community health workers, are a trusted source of information in the community, right? Promotoras can be trained to be tobacco treatment specialists, and it can be trained on that training and can help tobacco users quit while educating the community about tobacco dependence, as well as educating the community about cessation services that are available in the local community. Promotoras can also be great partners in increasing the availability of in-language cessation support. Tobacco treatment specialist trainings could also be offered to other qualified bilingual individuals in the community. So something that I wanted to remind you, though, in particular, whenever I talk about using promotoras in your work, something that we always have to remember, though, is to incorporate funding so that you are able to pay your promotoras to do this work. So stipends are super important for promotoras to do this work. So when developing services for the Latino community, it's also important to adapt services to Latino cultural values. So Luz already went over some of the cultural considerations that we should consider. However, we also wanted to share additional Latino cultural values that can be incorporated to adapt services. So for example, counseling services for Latinos should reflect respeto or respect. That is super important in the Latino community. Luz already talked about personalismo, right? Or formal friendliness. And also we talked about the value of family, that the value of family is super important in the Latino community, as well as taking into account cultural values like machismo and fuerza de voluntad, which is like willpower, which may lead many Latinos to favor cold turkey approaches to quitting, right? We also have to remember to provide services in safe spaces. Services should be offered in places where Latinos feel safe, in particular, Latinos who may be undocumented, right? So some examples can be in their homes, in local churches, schools or parks, or even sometimes in some community recreational spaces. They can be safe spaces, community clinics, or other venues that are commonly accessed by the Latino community in your community. So remember, get to know your Latino community in your jurisdiction and find where are those places where they're gathering. And other things to consider are offering flexibility in terms of when you're offering these services, right? As well as childcare. For various reasons, including childcare obligations, many Latinos have limited time. So cessation services should be provided at convenient times or flexible times, such as during evening hours or the weekends. And it could be a really good idea to provide childcare services, as this can be super helpful for some Latino families who don't have any other means to obtain childcare. And also, where feasible, we want to offer incentives to participate in tobacco cessation counseling. So the Medicaid Incentives to Quit Smoking Project, which is a large study that enrolled many low-income Latinos, showed that offering free NRTs and a modest financial incentive could increase participation and improve quit outcomes. So this is an idea that you may want to incorporate in any local services that you provide. We did want to remind you, though, if you are doing this as part of a C2CP funded initiative, that you do have to follow C2CP guidelines in terms of incentives. So just to recap a few things that we discussed, many Latino smokers want to quit, right? But often lack the appropriate guidance and resources to successfully quit smoking or using tobacco. So something that will help with this is creating culturally and linguistically appropriate educational materials, as well as creating culturally and linguistically adapted cessation services. So this is where local communities or local programs can make a really big impact. Local programs can really take the time to learn about the community. For example, simply making an assessment of the languages the Latino community speaks in your community. Don't just assume it's just Spanish, right? There may be some pockets of the Latino community who don't speak Spanish. They may speak other indigenous languages, right? So get to know the Latino community, and simply by learning who the community members are in your community, the languages that are spoken in your community, can really help you develop the materials that you need to reach the community. So we also talked about the fact that Latinos are less likely to be referred to their primary, by their primary care providers to cessation services. However, we know that Latino smokers want to quit, right? So for those that smoke, imagine how important the community health clinics are, and also how important the federally qualified health centers are for those community members, right? In particular, those that are without insurance, and also maybe those folks that are undocumented, right? So let's try to remember to highlight the existing services that exist in the community, but also let's remember what Dr. Valencia mentioned, right? Many Latinos may not seek medical services, right? We may not visit the doctor as often. So in addition to uplifting those existing services that exist in your community, we also have to think outside of the box and think, who are the other partners that we can partner with to promote cessation, right? Simply by just helping to pass from cessation service information, or maybe you can partner with other agencies to train a tobacco treatment specialists, to train promotoras as tobacco treatment specialists, right? So who are those partners that you can work with in your local community to provide those services to the Latino community? And I mentioned it's simply, even simply just partnering with like a promotora agency, right? And helping them incorporate some of these talking points into their current work. And this can look different in many different communities. Every community is going to be different. So remember, smoking is a leading cause of preventable death. So ensuring that the community knows about what's available and the help that is available in their community is a first step towards recovery. So just a reminder, this is the QR code to download the policy platform. A lot of the information that we shared here during this webinar is included in the policy platform. And we hope that you use the policy platform to engage and educate others in your community about these efforts. In particular, if you're trying to collaborate with others on these issues, on cessation services, this is a great place to start, as well as the other resources that we shared during the webinar. And before I get off the mic and before we go into question and answer, I would like to remind you that we do have a survey at the end of this webinar. We will be emailing this to you at the end of the webinar as well. You will, if you registered for this webinar, you'll receive an email. However, you can take a picture of it here if you would like to start taking the survey now. This is available. So now we would like to move on to question and answer. And I'm going to move the mic to Rosendo to help facilitate this portion of our webinar. Thank you.
Thank you, Annette. Thank you, everybody, as well. So we'll have an opportunity for questions in case any did come up, and we'll take a quick look at the chat box. In the meantime, I want to also encourage everybody to feel free to reach out to us via email, or also check out our Instagram page, where you can see they're listed on your screen. So I'll open it up to any questions anybody might have, and then we'll go from there.
So I have a question. You talk about the fact that KIKI California has provide other languages as well as Latin, and English language. So do they provide Farsi, a language for Afghan families or other Farsi-speaking communities?
Thank you, Tizzy, for the question. So I want to quickly check, do we have anybody from KIKI California on the call? Okay, I wasn't sure if I saw anybody. So my understanding is that I believe they do have, they have multiple languages, and I believe Farsi would be one. We can double check and confirm that, and we'll reach out and we can follow up with you, Atissa, and everybody else also registered here to see if there is, if that information is available in Farsi. All right, so we see a couple other questions. What would you recommend for tailoring the Great American Smoker for Latinx community? So I'll go ahead and just briefly provide some thoughts, and then allow the team also if they have any additional comments. So, considering some of the cultural values, Luz touched on family in the Latino culture, and as well as many other cultures, family has been identified as one of the main reasons why adults quit smoking, or at least try to quit smoking. I've heard of multiple cases in which simply, somebody had a child, or simply when they found out the harm that secondhand smoke was causing their kids, they just decided to quit all, entirely. So my recommendation would be to incorporate family-oriented messaging in some of these educational materials, or really outreach efforts, including for those for the Great American Smokeout, such as, protect your family, protect your kids from secondhand smoke, quit smoking today, or so anything along the lines of protecting their kids, protecting their family's health. That might be also tied in with the dangers of secondhand smoke and thirdhand smoke, if there is perhaps that gap of awareness in the dangers that it poses to their overall health, as well as other aspects such as cognitive function and academic performance, especially for your kids. So that would be my recommendation, is to really tie into the cultural approach and providing family-oriented messaging. And we can definitely look into some additional examples. And Luz, let's see, you have additional comments to share.
Yes, it's not specifically to this question, but I just did want to follow up with it too. So I just spoke with an agent from Kick California, and they mentioned that they do have language services for most languages. And then they also provided me with a number to request a translator. So I'll add that to the chat box.
Perfect. Thank you, Luz. I did see also a question Manuel mentions, is there existing tobacco cessation curriculum in Espanol already? Now, to my understanding, there is not, and I believe there are some efforts to create, especially more at the local level. Let's either you admit yourself, if you want to go ahead and.
Yes, so some local agencies or projects have developed or adapted existing programs and have translated it for their own use. So for example, I'm aware that some have translated the Freedom from Smoking curriculum for their own use. However, like I said, sometimes these programs don't work too well with the Latino community. So I definitely think there's a gap in this regard. And more is needed.
Yeah,
And I don't know if Cindy has anything to add.
I would agree. I think this is definitely a research gap, and this is where we all come in, right? To identify the needs of the community. I've been working in public health for 14 years, and I've learned that sometimes we build it, and just because we build it, it doesn't mean they're going to come. So super, super important to engage the community in what they need. But we have worked with current health systems, and they did translate the Fresh Start facilitator guide in Spanish with the intent, this was all over COVID, so with the intent of providing services in Spanish and building a CHW promotor network. Because of COVID, it's been delayed, but about 100 Medi-Cal members through Kern have received services over Zoom. So that is a pilot. We still haven't looked at the data, but it is available. And Bernie Ochoa, who has been providing these classes, is amazing and happy to share all of it, and a great resource if you're interested.
And Cindy, since you also have the mic, you shared something really important via chat, and I'm wondering if you could share that, verbally. And it's you mentioned that health systems can take an proactive outreach approach. Can you talk a little bit more about that, and how they could tap you for more information?
Yes. So I just want to say that through California Quits, we've worked with so many health systems, and we've worked to connect them to Kick It. We've worked on workflow, and we do have to do more than that, right? Even with the connectivity, it's a struggle to get those referrals to come out. So it's super important for health systems to work in bulk and to be able to access the data, identify the tobacco users that they have, and understand whether or not they've been assisted. If they haven't been assisted, it's exactly what we did in Los Angeles. In that study, we looked at unassisted tobacco users that had maybe had a visit in the past 3 to 6 months, right? If you pull this report, you might end up with thousands. I mean, thousands of people that are unassisted. But it might make most sense if you have limited resources to look at people that were in the clinic in the past 6 months, right? So that when you call them, they remember that they've been to your clinic. And all it is, we have a script, it's in the paper. it's a matter of calling and saying, you know, we see here that you're a tobacco user. Are you interested in receiving services from KK California? And that is how you obtain the consent, right? You're consenting to share this information with KK on their behalf. And so that's another strategy that can be done. You know, it's a little different than what we're used to, the ask, advise, refer. It's proactive. It's in bulk. You might be able to connect with hundreds of people versus waiting for serving individuals one at a time.
And there's also, you have research that backs this up, right?
It does. And so proactive outreach isn't new, it's effective. In our study, what we did is the local touch through area code. Instead of calling with an 888 number, we called with a 213 area code, and we're trying to see if there was a greater response to either. Response was not significantly different. I think if the sample size was larger, maybe we would have seen that, but consent was. So it's interesting that once we got them on the phone through the 213 area code, they were more likely to consent. So again, that local touch, there was something about that area code that, you know, may have increased trust and may have increased somebody's, you know, the opportunity to say yes, maybe was better through the area code. So that's where all of you come in to elevate the story and to say, hey, here's another strategy if you don't want to go through ask, advise, refer policy.
Thank you for sharing that, Cindy. And a couple of things I wanted to just touch on is well, number one is I know there's additional questions about, you know, some examples of existing materials. And so I do want to quickly mention that the Latino Coordinating Center, we do aim to create educational materials both in English and Spanish. We create obviously oral materials, and we work with any organizations that are working to also develop additional materials. And so feel free, if any of you are working to create any new materials regarding cessation for Latino community, and that you would like to collaborate on that, please feel free to reach out. We'll also be identifying or creating new educational materials within the near future. I also wanted to mention regarding cessation. Obviously, we want to work with existing healthcare plans and systems. Janet mentioned fairly qualified health centers, which is also a great resource, especially considering that many FQHCs are in rural communities or communities that there's a large Latino population, and they don't necessarily require health insurance to be seen. So many patients who don't have health insurance go there and then simply pay utilizing a sliding scale fee. And so that's also a great option, because with those without health insurance, they might be discouraged because they don't want to pay large amounts of money to go and seek services. Also, one of the things I also want to emphasize that you mentioned is really providing classes in safe places and places that people feel comfortable. For some, it could be a clinic. For others, maybe it might not be. Maybe it might be an apartment complex, a church, somewhere in the community that people feel safe and feel comfortable. It also, especially if we work with promotoras, that also might be a great combination. So people really feel at home, and there were people that they recognize, that they understand. And of course, if there's an opportunity to have incentives, then obviously that would be great. So I think what we want to emphasize is that cessation and treatment could occur not necessarily only in the medical setting, but also at the community setting and in different locations. And we definitely recommend to keep that in mind, as well as the time in which the classes are provided, considering that many people are unable to take time off from work to go and seek these services. Let me see if there's any additional questions. Yeah, very good question, Nancy. I do think that we do want to take some time to really look into that regarding specifically. It is a little difficult when there isn't necessarily grant funding. So we would like to explore that a little more thoroughly to give you a little better response. And so what we do plan to do is create a follow-up, kind of like a Q&A sheet or a FAQ sheet that we have done for some of our previous webinars with follow-ups regarding some of these questions that were brought up today, that perhaps we want to expand a little bit more, as well as include some of the resources and links that are provided, those that Dr. Valencia shared, those that also we have shared, including our policy platform and the Ask Advisor Refer guidebook for the Latinx community. So we'll be providing a follow-up in addition to, and also as a reminder that there'll also be a follow-up regarding evaluation. So we really do appreciate any time that you can also take to complete that, so we can also learn how we can improve our webinars.
Can I just say one thing about the CHWs and sustainability? I get that community health worker networks and promotora networks have historically been funded by soft funding, so they come and go. Medi-Cal managed care plans now have a CHW benefit. So that means that, you know, someone's going to get paid when they provide this service, we're tracking that. And to my knowledge, we haven't identified a CHW network or Promotora network that is doing this, but I think there's an opportunity there. So to connect with Medi-Cal managed care plans in your community to learn about what's happening. CalAIM, Medi-Cal Transformation, is supposed to help bridge those networks. And so there's incredible opportunity there for sustainability. If you're not connected and if you want to learn more, reach out to us. We work with 18 of them. And so we may be able to, again, help facilitate some of those warm handoffs.
Thank you so much, Cindy. That is super important. Thank you for sharing that.
So we are 2 minutes until the hour, and I don't see the initial questions come in. I do want to mention that this webinar was or is being recorded and will be posted on our YouTube page. And so please make sure to check that out. In fact, I'll go ahead and quickly put the link to our YouTube channel right now. Again, also the previous recordings for our other webinars are also found there. Feel free to check back to see once this webinar has been uploaded. Feel free to also reach out. We'll provide a copy of the webinar slides in case the slides as well as the recording. So again, it was great to have everybody join us. Thank you everybody for joining us this morning. Feel free to reach out to anyone on the team. Other than that, have a great rest of your morning. We look forward to working with all of you.
Thank you to our AC member, Dr. Valencia, as well. Thank you.
Absolutely.
Thank you.
Thank you, everyone.
Thank you,
Thank you,
everybody.
everyone.
Thank you.
Thank you.
Thank you all.